Most recently, for nearly 2 decades, he was a Canadian senator. But first, let's go back to his tenure as mayor. One of his top priorities there actually focused on harm reduction. He oversaw the installation of the city's first open, safe injection site. He was also a strong proponent for Vancouver's 4 pillars drug strategy, which prioritized harm reduction, prevention, treatment, and enforcement as strategies to combat substance use issues. And now he's taking on this new role at the age of 77, and in moments will be officially announced as so.
Let's go live now to Housing
People,
Minister
including
Christine
the
Boyle.
Musqueam, Squamish, and Tsleil-Waututh nations. I'm proud to be here today beside many wonderful leaders in the Downtown Eastside and my colleagues, MLA Amshin Joan Phillip and MLA George Chow, to tell you about good work that's coming. Vancouver's Downtown Eastside is a unique and vibrant community which has faced compounding challenges throughout the years, but has responded to those challenges with so much resourcefulness and community leadership. Well, we have taken important steps forward, such as bringing people inside and out of encampments by opening 800 new and renovated spaces for Downtown Eastside residents, and by supporting local nonprofits through investments that have allowed them to expand their facilities and services for the community. We know that more work is needed to deliver better outcomes for this community at the heart of Vancouver. That's why I'm grateful to be here with community partners, Sarah Blythe from the Overdose Prevention Society, Steve Johnson from Community Impact Real Estate Society, Carol Lee from the Chinatown Foundation, Angela McDougall from Battered Women's Support Services, Wendy Peterson from the Downtown Eastside SRO Collaborative, Bobby McDonald and Nicole Mucci from Union Gospel Mission, and Amanda Burrows from First United. Because there are no quick fixes for the ongoing challenges in the Downtown Eastside, but working alongside the community is how we will find a way forward and advance solutions that work. We know there's urgency to connect people to the supports they need, to get the right housing for the neighborhood, to help local businesses so we can improve quality of life for everyone in the Downtown Eastside. That's why we're naming Larry Campbell as our Downtown Eastside advisor to move forward lasting solutions. Mr. Campbell's focus will be on coordinating and advancing the province's ongoing efforts to improve outcomes for people, public spaces, infrastructure, healthcare, housing, and economic development in the Downtown Eastside. His experiences and relationships as a senator, Vancouver's mayor, provincial coroner, and RCMP officer make him uniquely qualified to take on this role, to work across the community and be the highly effective bridge we need to coordinate between municipal, provincial, and federal governments, and to build on the work started by our government to ensure we can deliver results for the people living, working, and gathering in the Downtown Eastside. I'm looking forward to working with him and providing updates on this progress. We're getting down to work right away, starting with meetings this afternoon with our community partners here and many more to come. Now I will invite Mr. Campbell to speak more about his appointment and the work that he's doing.
Thank you. Thank you, Minister. And thank you, everybody, for being here. I've been asked by the Premier and by the Minister to come and advise on the Downtown Eastside. And what I'm hoping at the end of the day is to be able to find a process with all of the people who are behind me here and the many hundreds, perhaps thousands of people in the Downtown Eastside that are working every day to make it better for the people who live in this community. I think I should start by saying I'm not a czar, just for everybody's knowledge, and I'm not a savior for the Downtown Eastside. The saviors for the Downtown Eastside are surrounding me here, along with many others who are, as I said, working today and every day down there to make things better. I think that I'm attached to housing because I believe that housing is the hub of the wheel, and that the spokes are women at risk, Indigenous people, people who are mentally ill, people who are addicted, the working poor, the people who are on the Downtown Eastside who desperately need housing. And I'm hoping that by working with the community, that we can achieve a process, and that's really what I'm looking for, is a process whereby people can move from their situation on the Downtown Eastside on the street into proper housing. I know that the Downtown Eastside has been over-consulted, over-reported on, and I have to say that I will be spending probably the next 2 months talking to them and making sure that we're all working together and that we're all going in the same direction. But I wouldn't have taken this position if I wasn't sure that with the help of these people and with the help of all 3 levels of government, that we can make changes here for the Downtown Eastside, for the citizens of Vancouver, and hopefully for the other cities in the province who find themselves in much the same position. I will take any questions that you have.
Mr. Campbell, could you tell us how much you're getting paid for this 6-month contract, and please tell the taxpayer what the total compensation is?
Yes, I'm getting paid $92,000 for 6 months, and I'm getting paid up to $10,000 in expenses.
That's the ceiling
That's the ceiling for, 6 months.
for the entire 6 months.
That's it.
So we've talked to many people who have a stake on the Downtown Eastside, and they're telling us that this is a very different place than when you were down there, when you helped with drug policy. We're talking, it's been decades. So what exactly is your mandate? What exactly do you plan to deliver on when you talk about coming up with a process?
Well, in 1973, I went to the Downtown Eastside on Drug Squad. And it changed from 1973 to 1981 when I started as coroner, 1986 when I became chief coroner. This is a neighborhood that has been in constant change. It changed again as mayor, and you're right. With the advent of fentanyl, it's a whole different ballgame down there. What I hope to do is to be able to deliver a process whereby we see changes, where we see people moving into proper housing. And I have to stress that when we say housing, we sort of imagine, I live on Galliano Island, a house. In fact, it's way more than that, because there's many people who just need housing. They need a roof over their head. They need a bathroom in the house, a kitchen. And almost everybody needs that. But some of the people in the Downtown Eastside need more than that. They're mentally ill. They need help with an illness. They're addicted. They need help. They're women at risk or have been abused. They need help. The Indigenous, they need help. So the housing that you provide has to be provided for the people that need it. So one size doesn't fit all. And I think that that's what I want to deliver to them, a process. And I think that right now, there's amazing things going on in the Downtown Eastside. And over the last, couple of weeks, I've been really looking at it, really thinking about it. And there's so much that's gone on down there and is going on that's good, but doesn't seem to be coordinated at a level at an upper level. On the street, you go down and talk to people on the street, they know, they can find places for you through all of the agencies. So on the street, they're connected. I'm not sure that follows all the way through. But what I want to be able to do is give them a process that we can move seamlessly from the street into housing that's supportive of whatever's going on.
But again, that sounds very
Yes,
vague.
ma'am.
Next question, please.
Yes, ma'am.
This is the next
Yes, ma'am.
You
I'm
had
sorry,
one question
ma'am.
and one
I'm sorry.
follow-up. Please
Next
let the new
question,
reporter
please.
go in with their outlet
Yes.
and switch places at the mic, and it will be one question and one follow-up. Please move.
Thank you.
Hi, I'm Denise Ryan with the Vancouver Sun.
Yes.
Mr. Campbell, you were instrumental in bringing in the 4 pillars health-rooted approach to addiction on the Downtown Eastside, but it's well known that over the last decade and more that not all 4 pillars have been put in place. What do you think you can accomplish in 6 months that advocates and other interested parties haven't been able to do in 15 years?
I hope to be able to bring in this process, as I said, and I agree with you. If you take a look at the 4 pillars when we started, the enforcement pillar was funded high. The other pillars, not so much. We've now moved to where the enforcement pillar isn't necessarily the highest, but harm reduction has become the highest. And so things like treatment and prevention have never got into that. And it wasn't like there had to be even Steven among all 4 pillars. But there was supposed to be some flexibility, and I just don't think that we've got to that point. Can we get to that point? I don't know. We can certainly try.
Do you mean within the 6 months?
I'm going to try. That's all I can say. I'm going to try.
Okay, can we have the next question? Please state your outlet. You'll have 1 question and 1 follow-up.
It's Brenna Owen with the Canadian Press. So you talk about this process of bringing kind of what's already happening on the street to a higher coordination level. What are some examples of how that, like, what might that look like? What might you be pursuing?
It might look like agencies in government, say, who are involved in the feeding of people. That there's a coordination going on among all of them so that we have some idea of how many people we're feeding, what the needs are, and how we go about meeting those needs. It's just a matter of trying to see, and in many cases, there is that coordination, and I want to see those cases and build off of them and learn where we go from there. I'm not saying that, as I said, I think there's some amazing things going on in the Downtown Eastside. But I need to go down there and take a look and talk to these people who are standing behind me and others who are down there to get a full picture.
Follow-up?
I actually have a follow-up for the minister. So this is a bit of a pivot, actually, from my colleagues. So local governments and housing groups have been calling for a roundtable, a provincial roundtable on housing to coordinate policy after what they describe as an avalanche of provincial housing policy in the last year or so or more. So is the province receptive to this kind of roundtable to bring more local voices forward?
I met with hundreds of local leaders at the Union of BC Municipalities meeting last week, as did my colleagues across government, and we'll be looking at what our follow-up steps are, including resolutions that were successfully passed, asks that came up repeatedly in meetings. Our provincial government has been using every tool in the toolbox to address the housing crisis and ensure that we're building homes for people. Absolutely, we've been taking large and serious action on a serious crisis, and we're always open to hearing from leaders and stakeholders in it. So I look forward to continuing that conversation.
Okay, is there any more in person for you to state your outlet? Okay, and that concludes today's event. Thank you.
Thank you very much.
You have been listening to the newly appointed advisor on the Downtown Eastside, Larry Campbell, holding a press conference there with the Minister of Housing and Municipal Affairs, Christine Boyle. Campbell said he will be paid $92,000 for the 6-month appointment, up to $10,000 in expenses. Now, he said he's hoping to find a process whereby people can move from their situation on the street into proper housing, saying housing is not a one-size-fits-all given the diversity of people in the Downtown Eastside. He also said he knows the Downtown Eastside has been over-consulted and over-reported on, but that he does plan to spend the next 2 months talking to people in the neighborhood. Again, Larry Campbell has been appointed as the special advisor, as an advisor on the Downtown Eastside. His job is to coordinate with partners in the neighborhood with the aim of improving the quality of life for all people who live and work in the Downtown Eastside. This is CBC. Much more coverage on this throughout the day here on CBC Radio 1 and CBC Television. I'm Michelle Elliott. Thanks for joining us.